right, this is a band hip mobilization with the band pulling from the side. This can be helpful for a stiff or painful hip that may be not responding to stretching. So you're gonna get a band at this low anchor, and you're gonna step into it and come out with the band pulling to the side. We want this band high in the hip crease there, pretty good tension, and I'm gonna be on hands and knees. I'm gonna start by just relaxing, letting that band pull my hip, but not my body. Some little movements up and down. You do that for maybe 30, 60 seconds. Then you're gonna have some little movements of the foot and the leg in and out. What's happening here is the band is providing what's called a distraction force. It's creating a little space in the joint, and we're doing some movements in a mid-range. So I'm not yet trying to force additional range of motion. So often I find that to just be painful. And if we get a little space in the joint, it's a mid-range movement, often that can actually improve range on its own. Once we do those, the final part is we're gonna get a little stretch, a structure called the posterior capsule. So I'm gonna cross one leg over the other. The one you're stretching often on the bottom, put some weight into this knee, and then you're gonna send this hip back towards your toes here, and kind of scour a little bit out through there. You want to keep your spine roughly straight, so I'm not just side bending like that, but I'm sinking down and trying to find a stretch through here. A visual that's a little weird but usually works. It's like I'm trying to push, here's my knee, I'm trying to push the edge of my femur, this bone here, out of my back pocket. So I really got some weight in there, and then I'm sitting my hip back towards my heels or my toes, and kind of moving through there. It should feel like a nice stretch through here. You'll feel the pressure of the band, but otherwise I don't want any lower back pain, don't want any pinching in the front of the hip. So this way, this technique can be a great way to open up a stiff or cranky hip. We have forward and back, side to side, and then this stretch. It's gonna feel like a glute stretch, but we're getting deeper into some structure of the hip called the posterior capsule. So it should take about 3 minutes to hit all of those. You can spend more time, and then you'll stand up and see how your hip feels.